A mastopexy is essentially a breast uplift, where the nipple and the breast itself is lifted from its original position to a new position on the chest wall. Well, there are many reasons, but probably the commonest reason is after women have had children, where you get a condition called postpartum involution, where during pregnancy the breast becomes engorged, and breastfeeding obviously, and then once that's completed, the breast involutes, or the glandular tissue decreases, and the breast drops on the chest wall with the nipple falling below the level of the inframammary fold. So women come to see me to have their breasts lifted up and to increase their upper pole fullness if possible at the same time. And then there are other reasons like asymmetry, or sometimes women are just naturally ptotic, which means droopy, I suppose, and they want their breasts lifted. So there are several reasons why you might wish to have a mastopexy. Well, clearly any breast operation can be uncomfortable. There are various different techniques of doing mastopexy with different scarring, such as periareola, which is just around the nipple, vertical scar, J scar, or the classic wise pattern. If there's a lot of skin to be reduced, you probably have a wise pattern type, inverted anchor type incision. So the more scarring and the more the breast is moved, the more painful it can be. Generally, simple analgesia after the operation, such as paracetamol and even brufen, can get you through if it gives you some idea of the pain involved. But normally you're back driving after a couple of weeks, you're out of hospital either the same day or the next day. Everybody's an individual, obviously, but it's not a particularly painful procedure. One of the things that you have to consider when you're having a mastopexy is it's important to differentiate the aesthetic outcome from the functional outcome. Now, obviously, psychosexual health is very important in women. And whilst you can make the breast look nice, one of the problems with the mastopexy is the potential for the loss of nipple sensation, or even worse, if you get a complication, the potential for loss of some or all of the nipple. So what you don't want to do is end up with a nice looking pair of breasts that actually have no psychosexual function because the sensation has been damaged. And obviously the scarring can be quite considerable. So you can look very good in clothes, but sometimes out of clothes with the scarring underneath the breast itself can look less attractive in certain positions. So all these things should be discussed with the patient in some depth before undergoing a mastopexy. It's not a simple solution to a difficult problem. There are multiple things that need to be decided before you proceed. Well, obviously after surgery, one should be sensible. I mean, you shouldn't smoke. I mean, you shouldn't smoke before the operation, because one of the problems with mastopexy is delayed healing, or skin and fat necrosis in the breast, which is increased dramatically in smokers, as well as infection. In fact, all complications are increased in smokers. So no smoking, please, and preferably avoid any nicotine containing things like vapes or patches, etc. So a non-smoker would be much better off than a smoker. You'll be in a bra for a couple of months, a non-underwired bra. Now, not the best thing to have to wear. The non-underwired bras aren't the most attractive things. So for the first couple of weeks, a relatively supportive non-underwired bra, and then as the healing progresses, you still need to stay in a bra day and night. But if you want to look a bit more attractive, you can cut the wires out of an underwired bra, because often they're much more attractive than the non-underwire bras, and that allows a little bit more of a social interaction to go on in the normal post-operative period. So bra for 2 months. In terms of physical exercise, once the wounds are healed, you want to avoid anything that in the early post-operative period that causes too much sweating, because sweat tends to accumulate in the underbreast area, as all women know, and what you don't want to do is get the scars wet with sweat. So clearly vigorous gym activity is not a good idea until the wounds are well healed. And obviously swimming is out probably for about a month or so after the operation, again, until the wounds are well healed. But otherwise, in terms of going back to work, normally a couple of weeks and you're back to work. Obviously, if you've got young children, you've got to be careful lifting them. If they sort of hold on tight to your chest, that can be uncomfortable. But again, 2 to 3 weeks, you should be okay with that. There's no muscles involved in the procedure, so no cutting of the muscle, etc. So in terms of shoulder movement, etc., it shouldn't be too uncomfortable. And as I say, as an index, you're normally back to driving after a couple of weeks, which is a good index of general activity, I think. Again, everybody's an individual, and it depends on, a lot of it depends on individual factors, patient factors, as I said, like smoking, general health, the condition of the skin. So some women's skin is a lot better condition than others. Younger women tend to heal faster than older women for that reason. And also, of course, the degree of the dissection. So if you've had a periareolar type, slight mastopexy, where the breast nipple has only been lifted a couple of centimeters, you'd expect that to heal a lot faster than a full wise pattern mastopexy, which is a very similar type of incision to a reduction mastopexy, which can take a while to heal. And indeed, delayed healing is one of the problems with mastopexy sometimes. So although it doesn't prevent you from doing relatively normal activity, you might need to have some dressings for a few weeks longer than you'd anticipate if you get some delayed healing from the scarring. So it's patient factors, as I say, general health, skin health, smoking, weight. You wouldn't want to have a mastopexy if your BMI was over 30, for instance. That's associated with complications. And then surgical factors such as the degree of scarring, and any complication, obviously, such as infection can delay healing. But generally, as I say, most patients, a couple of weeks, everything's healed up and everything's fine. But, you know, never trust a surgeon who says he's perfect, because he's either not done enough surgery or he's lying, because we're dealing with biology here, and, you know, sometimes complications do happen. So it's always worth bearing in mind that you may have to have dressings for longer than you anticipate, but on the whole, it's not generally a problem. This is related to what the cause of the problem was, whether it's due to poor skin or postpartum involution. As I say, whether you get pregnant again, of course, that can be an issue, because the breast will swell and then drop again. The size of the breast can have an impact. So if you've got very large breasts and you just have a mastopexy without a reduction, it's much more likely that gravity and age will cause the mastopexy to drop again. And there is a condition called pseudo-ptosis, or bottoming out, where the lower part of the breast can drop and the nipple can stay high. That can occur particularly in women with larger breasts. So again, it might be worth talking about whether you want a reduction as well as a mastopexy, or reduction mastopexy rather than just a simple mastopexy at the time. Because clearly, if you're just tightening the skin envelope over a heavy breast, then that will lead to a more rapid reappearance of the ptosis in the future. So again, it's patient factors, skin health, and the size of the breast and the age of the patient, and the weight of the patient, etc. All of that can feed in. But generally, you can give the patient some idea of how long it's going to last when you see them. So to come up with a figure just plucked out of the air would be inappropriate. It's very much an individualized thing in terms of the degree of success and how long it's going to last.